Hey everyone, this is Joseph Katz with CoverRight. Welcome to another edition of our Medicare Mondays webinar series or podcast, or call it what you want. Here again with CEO and CoverRight co-founder Richard Chan. How are you today, Richard?
I am well, Joseph. Good to be back on talking about Medicare.
Excellent, excellent. So I got a big question. Everyone wants to know. How much does Medicare cost? Now, I know because I've been working with you, it's not a simple answer, but maybe you could, give a few points about the cost of Medicare and things people should think about.
Yeah, I was about to say it's a loaded question. Happy to run through the key costs of Medicare. I think in terms of where to start, I think everyone needs to sort of understand that there is sort of a baseline of costs to be in Medicare. The base program for Medicare is called Original Medicare, two parts. Part A, hospital coverage. Part B, medical. I'm sure a lot of people have heard of those two terms before. Part A, hospital coverage, is actually premium free for a lot of people. So if you paid your Medicare taxes or worked for 10 years and paid your taxes, Part A is free. That's only the premium portion, though. What a lot of people don't know is that when you go into the hospital, there is a deductible of about $1,500 that will cover your first 60 days of stay. There are other costs that are involved in Part A. We won't have to go into those, but those are probably the two key things you're thinking of. For Part B, which is medical insurance, for anyone who doesn't know what that covers, doctors, ambulance visits, anything that's sort of outpatient, so not in the hospital. The base premium is about $170 per month in 2022. That's gone up. It went up quite significantly from 2021, which is about $148. And that can range all the way up to about $600 a month, depending on your income. When you sign up to Part B, they'll sort of check your income from 2 years ago to determine what that premium is. That's the premium side of Medicare Part B. And then the other cost that a lot of people probably have heard of is this 20% coinsurance, which means that if you use any services under Part B, it costs 20% of the cost that you have to pay, and Medicare will pay 80% of the cost. So that's the cost for sort of the baseline original Medicare program.
And that doctor visit in Part B, how does that differ from, we talked a couple of weeks back about Medigap and Medicare Advantage. How's that?
Yeah, that's a good question. So, once you get past the baseline Medicare program, which you have to be enrolled in, you can add private coverage on top. Now, the three most well-known, or three private coverages that you need to know about is Medicare Part C, which is Medicare Advantage, Medicare Part D, which is prescription drug coverage, and Medigap, also called Medicare Supplement. For Medicare Supplement, those are plans that help cover the out-of-pocket costs in Part B. So you typically pay a premium in the range of $90 to $300 a month, depending on your health, depending on your age. And what that gives you is people call it Cadillac coverage, or very comprehensive coverage, which means when you go to the doctor, you pay nothing. So your Medigap plan will pay the 20% coinsurance for you, but you have to pay extra monthly premiums. So it's $170 plus the $90 to $300 each month.
And that additional amount is variable based on health, age, geography. What's the factors?
Yeah, there's a number of factors, and I think all three of the ones that you just mentioned go into it. There's some plans that they're called community rated or age rated, which kind of depends on how they're priced. One means everyone pays the same price. The other means it steps up as you age. But similar to other insurance, for Medicare Supplement, they will underwrite you based on your health. So if your health is not as good as someone else's, they could charge you a higher premium.
So there's a lot of variables. If the cost is not going to be the same from person to person, it sounds like.
Yeah, the answer to that is twofold. There is something, and there's probably a whole nother episode about this, that is called the Medicare Supplement Open Enrollment Period. which is when you turn 65, there's a small window of about 6 months where you can sign up for a Medicare supplement plan without any underwriting. And so at that point, everyone pays the same price. If you decide after that to come in and buy a Medicare supplement plan, then the insurer can go, well, I'm going to check your health, do you have pre-existing conditions, all those sort of questions.
But even when everyone joins in that initial enrollment period, are all the plans exactly the same, or is it based on geography or I mean, everyone's 65, but
yeah, that's a good question. So when you're within a certain geography, turning 65 during that open enrollment period, the price will be the same.
Regardless.
The prices will be different across geographies. And then within Medicare Supplement, there are different types of federally standardized plans. So they're alphabetically labeled from A to N. If you pick N from one company and N from another company, they are the same coverage. And the prices between different insurance companies might differ. But that's just, shopping, how you normally shop.
So what I think is worth calling out, and you correct me if I'm wrong here, if I live in New Jersey and a friend of mine lives in Illinois and he says, you should get this Medicare insurance, it may not be the same, right? Because I'm in New York and New Jersey and he or she is in Illinois. So same exact plan could be two different prices, right?
That's right. So even though it's federally standardized, like for example, someone in Illinois, someone in New Jersey, like the prices could be very different. A very good example of that is actually in New York State. New York State's got some interesting rules that actually alters the way insurance carries price, and so you might see that price 2 to 3x what your friend is paying in New Jersey.
So the key here, and I think we can end on this little point, is there's a lot of variables that make up your Medicare costs and what's covered. We didn't even dig into the drug piece, which I know you mentioned a few minutes ago, but getting the right advice, understanding what you're looking at the right time are sort of critical. And just because I have something in one location doesn't mean it's going to work for someone in another location because of their, personal history and or the cost structure. So the advice that I think we would give at CoverRight is, talk to someone who knows the ins and outs of Medicare, knows your particular situation, and what's going to be best for you is not necessarily going to be best for someone else. So
that's right, and it's really easy to check prices on our platform as well. So if you hear of something and you're curious about it, our technology does give you that personalized rate depending on your health location, age,
making it very transparent for everyone who wants to easily shop. So Richard, thank you for your time. Thank you for those insights. There's obviously, as you mentioned, more to dig into in some of these particular plans. We can always cover that in a future episode. If anyone has any questions for the team at CoverRight, they can reach out to hello@CoverRight and check out the platform, poke around, you see if there's something there you can help you solve your personal Medicare needs. So until next time, Richard, thank you. Thank everyone for listening, and we'll see you soon.
That's it.